In my opinion, EMR is not what it was 5 years ago. It's certainly not what it was 10 years ago. When the inception of EMR was 35 or so years ago. Since then, what we can do with EMR is crazy different to what we could do then. But we can also do things that we never believed we could do with EMR in 2024. So I'm just going to get into that. I think this is a very important slide for understanding where you can be if you are an expert. That is, that most of these patients, the vast majority of them, can be treated as outpatients. That your procedures should certainly be safer than surgery, and your procedures therefore should be cost effective. What are, and this is 2023, but it remains true in 2024, what are the issues, things that EMR still can't do in 2023, 2024? Well, we have problem with post-EMR bleeding. For sure. And that's why I want to bring technique of defect inspection and thermal ablation into this course, and recurrence and how we can deal with it. I think it is broadly accepted that prophylactic clip closure of defects reduces post-EMR bleeding. But, I mean, let's volunteer. Everybody give a reason why there's a problem with mechanical closure with standard clips.
Because of the size.
It's usually, once the size of the defect is a bit too large, it will be very difficult and also become very expensive to get 20-ish clips sometimes in. Will make less cost effective, let's say, maybe, and just difficult to do.
Mm-hmm. I think cost, I hear cost there, difficulty. The only reason to choose en bloc over piecemeal is cancer risk in 2024. I think one of the critical things about EMR, and the reason why EMR is quite roundly criticized, is for the, patient needs to come back after 6 months, then needs to come back after a year after that, and blah, blah, blah. And with ESD, we can come back after 3 years, right? And then everything's fine. I think that this course, in combination with a structured fellowship, can really help you in terms of your not having any problematic situations that you may have seen in the previous slides slip by in your practice. But it can also really help you in terms of understanding whether this is what you want to do or not.